CIET NCERT presents the audiobook of Physical Education and Well-being titled Khel Praveen for Grade 9.
Page number 54. Unit 2. Science and Sports. Chapter 7. Growth, Development and Maturation. Have you ever noticed that after the same exercise, some of your classmates recover quickly, while others take longer to catch their breath? Let us find out why. Perform an activity such as skipping or jogging for 1 minute at a steady pace. After the activity, observe and record how your body responded. Your breathing rate, heart rate, sweating and muscle fatigue. Compare your responses with your classmates and discuss why different individuals may respond differently to the same activity. In this chapter, you will study how differences in growth, maturation, and development affect strength, endurance, coordination, and recovery, and why these changes occur at different rates for each person. Growth. The changes that occur in the size and composition of the body, or in the dimensions of a specific body part, are termed as growth. For example, as children, your bones lengthen and muscles grow, making you taller and heavier. Growth is the most significant biological activity in the first 2 decades of life. Figure 7.1 has been given here. It shows the various stages of growth of a small baby girl to a young lady. Page number 55. Development. Development is not limited to size or the body composition. It can be both behavioral and biological, such as the development of motor skills or learning teamwork or controlling emotions during sports. Development is shaped not only by your biology, but also by your experiences. Maturation. Maturation is the progression of the body towards adulthood. It can happen at different ages, rates, and times in almost all individuals. Even within one person, all systems do not mature at the same time. For example, our skeletal system matures much later than our reproductive system. Table 7.1 outlines the differences among growth, development, and maturation. Table 7.1 has been given here, which outlines different aspects of growth, development, and maturation. This table has 4 columns titled Aspect, Growth, Development, Maturation. First is meaning. Growth. Structural and physical change, increase in size, height, weight, and length. Development. Overall change in shape, structure, functioning, skills, and behavior. Maturation. Progression of the body towards adulthood and full functional capacity. Nature of change. Growth. Quantitative. Measurable changes in size or weight. Development. Qualitative. Improvement in function, skills, and behavior. Maturation. Qualitative and biological. That is, timing of changes in body systems, for example, puberty and skeletal maturity. Aspect relation. Growth, part of development, the quantitative aspect of development. Development, wider term, it includes growth and other qualitative changes. Maturation, supports both growth and development by determining when body systems are ready. Continuity. Growth stops after maturity is attained. Development throughout life. Maturation until full maturity of systems is achieved. Different systems mature at different times. Page number 56. Aspect. Measurement. Growth. Measurable. Height, weight, and organ size. Development, hard to measure, assessed through skills, behavior, and complexity. Maturation, indicated by biological markers, puberty, skeletal maturity, and hormonal changes. Aspect, process, growth, cellular, multiplication of cells and increase in tissue. Development, organizational, better coordination, improved skills and behavior. Maturation, biological and functional readiness. For example, reproductive maturity and bone growth completion. Aspect, dependency, growth. Growth may or may not bring development. Development is possible even without growth. Maturation sets the pace for growth and development. Aspect, example, growth, increase in height and weight. Development, learning to walk, read, or play sports. Maturation, onset of puberty and closure of growth plates and bones. Table 7.2 has factors influencing growth, development, and maturation. Table 7.2 has 4 columns titled Factor, Effect on Growth Quantitative, Effect on Development Qualitative, and Effect on Maturation Qualitative. First factor, genetic or hereditary. Effect on growth determines height, body size, and skeletal proportions. Effect on development influences motor skills and cognitive ability potential. Effect on maturation regulates the timing of puberty and system-specific maturation. Factor, nutrition, growth, adequate nutrients increase body size, muscle mass, and bone density. Development, balanced diet supports brain function, learning, and motor skill development. Maturation, deficiency or adequacy affects onset and pace of puberty. Factor, hormones, growth. Growth hormones and thyroid hormones regulate cell multiplication and bone growth. Development, hormonal balance aids proper organ development and function. Maturation, sex hormones, that is, estrogen and testosterone, trigger reproductive maturity. Page number 57. Factor, physical activity and exercise. Growth, stimulates bone density, muscle hypertrophy, and cardiovascular growth. Development, improves motor coordination, strength, flexibility, and skill acquisition. Maturation, enhances readiness of musculoskeletal and neuromuscular systems. Factor, health and medical care. Growth, illness or chronic disease may stunt physical growth. Development, good health supports learning, concentration, and psychosocial development. Maturation, preventive care ensures normal and timely biological maturation. Factor, environment. Growth, pollution or toxins may restrict body growth. Development, safe surroundings encourage exploration and learning. Maturation, poor conditions may delay or disrupt maturation processes. Factor, psychological and emotional domain. Growth, stress can reduce growth hormone secretion. Development, emotional support improves confidence, behavior, and cognitive development. Maturation, stability aids smooth transition through adolescence and puberty. Factor, socio-economic domain. Growth, access to food and healthcare improves body size and growth. Development, education and facilities enhance social and intellectual development. Maturation, higher socio-economic status often linked with earlier or normal maturation. Factor, cultural and lifestyle. Growth, diet and lifestyle habits influence growth rate. Development, traditions shape behavior, learning and skill sets. Maturation, lifestyle choices, sleep, rest, and activity affect hormonal cycles and maturation speed. Does this mean performance changes in sports are always because of training? Not necessarily. Physical performance naturally improves as children grow, develop, and mature. Therefore, teachers must observe these changes carefully. If a young athlete suddenly gets faster or stronger, it could be because of training or because their body is going through a natural growth spurt. Hence, thorough understanding of these processes is very important. Page number 58. We often use terms like children, adolescents, youth, and young athletes. These are sometimes used interchangeably because it's hard to put them in exact age ranges. For example, children, students under 12 years of age, adolescents. This period begins with puberty, which can start early or late, therefore, there is no fixed age. Youth, often used as a global term for anyone under 19 years. Young athletes, a similar age range of students as that of youth, but with a focus on sports participation. Did you know? Growth plates. Bone growth plates are areas of cartilage near the ends of children's and teenagers' long bones where new bone is added, allowing bones to grow in length and width. They are also called physes and are made of flexible cartilage, but they harden into solid bone or close after puberty, which marks the end of bone growth. Growth plates are weaker than surrounding ligaments and tendons, making them susceptible to fractures that can affect future bone growth if not properly treated. Figure 7.2 has been given here, which has parts of a fully grown bone. The various parts pinpointed are wrist bones, wrist joint, epiphysis, physis or growth plate, metaphysis and diaphysis, ulna and radius. Age determination. Growth plates are used to determine the age. The Tanner-Whitehouse 3 TW3 method is a sports age determination technique that uses an X-ray of the left hand and wrist to assess skeletal maturity. Vertical load-bearing exercises should be restricted at pre-adolescent stage as it affects the epiphyseal growth plate or primary ossification center, and peak height velocity will be compromised. Trivia. Amla Navami, also known as Akshaya Navami, is a festival celebrated on the 9th day of the bright fortnight in the month of Kartik. It honors the Amla, Indian gooseberry tree, believed to be sacred and symbolic of health and well-being. The Amla fruit is rich in vitamins, specifically water-soluble vitamin C, and is believed to boost the immune system, enhance liver function and support digestion, among other benefits, and can be consumed in any form. Page number 59. Activity. Life cycle of bone. Observe your peer group and identify the differences among them related to growth, development, and maturation. Figure 7.3 has been given here. On the y-axis, bone density has been given, while on the x-axis, various ages in years have been mentioned, ranging from 0 to 70. Two graphs have been given here. The one in green tells about genetic peak bone mass achieved with healthy lifestyle choices, along with which healthy habits have been given and healthy food options have also been given, like having healthy diet and doing various forms of exercises. The red graph shows the genetic peak bone mass not achieved due to poor lifestyle choices. Here, unhealthy foods have been given, like junk foods, and a comparison has been given of osteoporosis, where healthy and unhealthy bones have been shown, one with normal bone matrix and the other with bones with osteoporosis. Exercises. 1. Explain how biological development, motor skills, and behavioral development help you. giving one example of each. 2. How are heredity and environment responsible for growth? 3. Two students of the same age have different heights. Explain the difference in terms of growth and maturation. Chapter 7. Growth, Development and Maturation ends here.
Khel, Praveen, you were just listening to this audiobook, Textbook of Physical Education and Well-Being for Grade 9. Narrator, Vaibhav J. Srivastav. Sound recordist, Muhammad Faizan. Assistance in production, Soumya Malik. Directed and produced by Vimlesh Chaudhary. This audiobook is brought to you by CIET NCERT, New Delhi, India.